Hello, good evening, everyone. My name is Mr. Alan again. It's Thursday. We're going to have your Facebook Live tonight. So it's going to be nursing, prioritization, and delegation. So we have prepared special questions for you tonight, everybody. So how is everybody doing? I'm sorry we're late a little bit, but we're all now here. So let's have a shout out to some students here. Okay. So the ones who just came in, let's appreciate those people who signed in early tonight. Okay, so we have, let's say, we have Nerissa Ran Capero. So thank you for being here. Noel Borgos, Catlea Espiritu, Claire Barker, also Fresel Paz. Okay, then also Rachel John, Sadia Saman, Joyce Flores, also Iyisha Kanu, and MC Ferrarin. Okay, so again, without further ado, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator for almost 25 years, and I have been teaching students past their NCLEX examination. Currently, I'm also a nursing faculty in a nursing program helping students pass their nursing program. And also, I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. At the same time, I have a book that I published in Amazon. The name of the book is Simple, Fast, and Easy NCLEX Review. And it's available in the Philippines. Okay? And it's available in the Philippines, and you can email Matus Nursing Review academy@gmail.com if you wish to order the book. Okay, it's available in black and white in the Philippines, but of course you can buy it of course in Amazon as well. Okay, now let's see. So again, the name of the book is Simple, Fast, and Easy NCLEX Review, everyone. Okay, all right. Okay, so our first agenda for tonight, everyone, is going to be our testimonial or our motivational photo of the week. So this was sent to us by Chi. Chi is one of our students in the online academy, and she sent this picture. She's studying, of course, and you can see all the post-its also. So really very determined to pass the NCLEX examination. So we wish you the good luck, to hopefully pass your NCLEX-RN. She actually passed her NCLEX-PN last month, I guess, and now she's taking her NCLEX-RN. So congratulations and good luck on your journey to pass your NCLEX-RN examination. Okay? All right, so we would like to share also our testimonial for tonight as well. So we have Jennifer. So Jennifer just passed her NCLEX examination. Okay, so Jennifer said in her recommendation in our Facebook page, I found Matus Nursing Review on YouTube, so I decided to enroll in the self-review. I also purchased the book on Kindle. The lectures made me understand the concept more, and it's not hard to remember. I really recommend Matus Nursing Review, especially the live discussions on Facebook. I got a lot of prioritization and delegation questions. I'm officially an LVN. Thank you, sir. More power. So congratulations again, Jennifer, for passing your NCLEX-PN. All right, so we would like to hear more stories of people who have passed the NCLEX examination. And of course, I'm always excited to hold this Facebook Live every Thursday because a lot of students really go back to us and tell us that it helped them a lot in their NCLEX licensure. So thank you very much, everybody. And I'm really very happy that it's helping you out in your NCLEX exam, okay? All right, so again for tonight, we're gonna have your free 90-day online access NCLEX review. So all of you who are joining tonight and making comments, you will be placed again in the raffle. So let's see who will win tonight. So we'll announce tonight the winner immediately after this show, okay? All right, so we have Joy Soliman, just giving her a shout out. She's watching from California, okay? And we have a lot of students, okay? All right, and of course, before we start our Q&A session, everyone, I would like to also request everybody, if you can share this session with your classmates or friends so that they will also benefit from the program. And also, if you're watching this in YouTube, you can click subscribe so that you can get more videos as well, okay? All right, so Are you ready for our first topic, everybody, for tonight? I'm not sure if you know what's our topic for tonight, but our topic is one of the most important topics that you need to master in the NCLEX. It has something to do with lab values tonight. So our first two questions are about laboratory values. So let's see how you'll be able to answer correctly in terms of prioritization and delegation as well. Okay. All right. So let's see the question, everybody. But before that, let's get a shout out, guys. Okay. Shout out also to Bray Dinsai. So thank you for being here. I think it's your first time. Also, oh, my teacher in my instructor in way back in my nursing school is here also. Hi, Miss Shiboom. I'm giving you a shout out. Okay. All right. Thank you very much. Awesome instructor. Okay. Now we have Alfred Tablada is from the Philippines, and then also Claire Barker. Okay. Ruth. Michelle Derayunan. Hi, Michelle. How are you doing? She's one of our students in the academy. Okay. Loretta De Leon. Okay. We also have Asta Gimiri. Okay. And also Kaylis Johnson. Hi, Kaylis. She's our winner last week. Also, we have Olayinka Tade Magbeke. All right. So anyway, everyone, let's start with the first question for tonight. Okay. So number one, are you ready, everybody? Okay. All right. So yes, Bray, we're giving you a shout out for tonight. Okay. All right. So first question is going to be prioritization. You're gonna have your 4 patients again, and then you have to find out, which patient is going to be your priority. Okay. All right. So the first question is, the nurse reviews the lab results of the following clients in the medical surgical nursing unit or medical surgical unit. Which client requires immediate attention? A, the 23-year-old client with rheumatoid arthritis who has a positive C-reactive protein and elevated ESR. B, the 36-year-old client with advanced liver cirrhosis who has elevated AST and ALT. C, the 45-year-old client with leukemia who has a platelet count of 100,000 per microliter. Letter D, the 50-year-old client with stage 4 lung cancer who has a WBC count of 8,000 per microliter. So let's see if you can answer this very simple question for tonight pertaining to lab results. Okay, lab results. Okay, very simple question, everyone. So let's see again. So number one, the nurse reviews the lab results of the following clients in the medical surgical unit. Which client requires immediate attention? A, the 23-year-old client with rheumatoid arthritis who has a positive C-reactive protein and elevated ESR. B, the 36-year-old client with advanced liver cirrhosis who has elevated AST and ALT. C, the 45-year-old client with leukemia who has a platelet count of 100,000 per microliter. Or D, the 50-year-old client with stage 4 lung cancer who has a WBC count of 8,000 per microliter. Okay, so let's see what's your answer, everyone. What's the answer? A, B, C, or D? Okay, for this question. All right, it seems like everybody has the same answer. Let's see. So, okay. All right, so the answer to this question, direct to the point, everybody, will be letter. Okay, very good. That would be letter C, everyone. This seems to be a very simple question for the NCLEX. Okay, your platelet count is something that you need to remember. It's 150,000 to 400,000. It really is different from laboratory sometimes. So 150,000 to 400,000. It depends on the lab. And the NCLEX knows that when it comes to labs, that there are differences in the lab values. So when lab values are being asked in the NCLEX, usually they will make the value really abnormal so that you pick the right answer. Okay, so letter A or letter C is going to be the answer to this question, everyone. Okay, and for letter C, we have to place the patient on bleeding precautions, everybody. And the question is, do you know your bleeding precautions, everyone? If you're going to be asked in the NCLEX, select all that apply. What are examples or interventions in bleeding precautions? Do you know them? Okay, so A is not the answer because A, you have rheumatoid arthritis and positive C-reactive protein and elevated ESR will be expected. Okay, will be expected, because there's inflammation. So C-reactive protein and elevated ESR or erythrocyte sedimentation rate mean that your patient has inflammation going on in the body. Okay, so that's expected, and there's inflammation, but the question is that really life-threatening as well? Now, your letter B, your elevated AST and ALT, when someone has liver cirrhosis, we kind of like expect that the enzyme levels will be elevated in the liver function test. So your aspartate aminotransferase and your alanine transferase, your ALT, will be elevated, and that will be expected as well. Okay. Now your letter D, your WBC of 8,000 is normal. It's normally 5,000 to 10,000. Your WBC, so we don't have to worry with letter D. Now letter C is a priority. Number one, it's abnormal, and number two, you have to think, is bleeding a serious situation? Of course, okay, because your patient can have gastrointestinal bleeding in the urinary tract, or the patient can also have intracranial bleeding as well. Okay, so that's why letter C is the answer. So we have Ashta Gimiri is putting in the comment section also anything about, everything about your bleeding precautions, everyone. So be aware of that, guys. Okay, all right. So next, what do we have? So number 2 question is also very simple. Okay, but let's see if you know the answer to this. But before anything else, also, usually with my students, if I send them the workbook when they enroll in the program, I send them this bookmarks. My students receive the bookmark, and it has all the lab values. So when my students are studying, they can actually just see the bookmark. Look at the bookmark, and then all the lab values are here that they need for the NCLEX. So when they're studying, so I send them all these bookmarks. Okay, so very nice bookmarks, and let me know which students we have here at this time has received the bookmarks, everyone. I really like them as well because it's an easy reference. Okay, all right. So another one or another question, guys. Number 2, are you ready? So number 2 question. The nurse cares for a client who has been admitted due to a hip fracture. Which lab result should be reported immediately? A, INR of 1.1, B, aPTT of 35 seconds, C, D-dimer of 400 nanogram per ml, D-dimer units, letter D, PT of 14 seconds, and E, potassium of 3.8 milliequivalents per liter of blood. Okay, simple laboratory question. The nurse cares for a client who has been admitted due to a hip fracture. So which lab result should be reported immediately? Okay. All right, so what's going to be the answer? So MJ Enriquez said she has the bookmark. Yes, MJ, thank you, MJ. So MJ is here. Gonna give a shout out also to Lisa Logiste. And Lisa, thank you very much also for giving us additional information in the comment section about your bleeding precaution, because that's really very important in the NCLEX. They ask those questions, about your bleeding precautions. How do we prevent injury in patients who have bleeding tendencies? Then also, I would like to give a shout out to someone who just came over as well, Rich John Hannah Nicardo. So Rich John Hannah Nicardo is one of our winners last time. Jem Lin also. Okay, so let's see the answer. Now, if you put your answer, I would like to challenge you. Can you please put also the rationale for your answer? Okay, the rationale for your answer. Okay, so which lab here? Okay. Well, Loretta also has a question. How can you get the bookmark? Usually the bookmark comes together with a workbook. Okay, when we send the workbook, I put my dedication at the back of the bookmark. Okay, that comes with the enrollment. Okay, it's just an additional resource for students that I provide them, you know, the bookmarks. Okay. All right, so you have the answer will be, let me see. I think we have very smart students for tonight. Let me see. Okay. Now, the question is, are all of these values normal, or which one is abnormal among all of this? Okay. Which one? Are they normal or abnormal? Okay. So let's proceed, everyone. Let's see the answer to this question, everybody. Okay. All right. So the answer to this question is going to be letter. Let's see if you got it right, everyone. Let me see. You are all exactly correct. That would be your D dimer. Okay. D dimer 400 nanograms per ml D dimer units. What does a positive D dimer result mean? It means that your patient may be having pulmonary embolism or DVT or forming a clot in the body. Very good. So that will be letter C, your D dimer. Okay. Now I do have a question to everyone though. You know, I do have a question. My question is, what is the normal D dimer? What is the normal D dimer result, guys? What's the range or what's the normal D dimer? That would be very, very interesting, right? What's the normal D dimer, everyone? Can you please let me know? All right, so A, INR of 1.1, 1.1 is considered to be normal. 1.1 or below is considered to be normal to a patient who is not taking warfarin. But we discussed the last time that if your patient is taking warfarin, the INR should be 2 to 3, right? If you're taking Coumadin or warfarin, the INR should be 1.1. So 1.1 and below in some books or resources says that it is okay for someone, okay, who is not receiving Coumadin. That's a normal result. Your letter B, your activated partial thromboplastin time, which is 35 seconds, is normal. You know, your aPTT is somewhere in the, let's say, 30 to 40 seconds. So that's acceptable, okay? Now, letter D, your PT of 14 seconds is also acceptable because PT could be somewhere from 11 to 16 or sometimes 10 to 14. It depends on different resources. However, 14 seems to be really a normal value. Okay. Letter E, of course, your potassium. That's expected to be normal. That's normal potassium is 3.5 to 5. So that's expected. Now, let's dive a little bit into D dimer because a lot of international students or students have not heard about D dimer. So D dimer is actually a protein that is a product whenever you form clots in the body, you know, a degradation product, a fibrin degradation product. So once D dimer is present in the body, it may indicate the presence of clots. We don't know where the clot is, we don't know the location, but it could be an indication of deep vein thrombosis or a possible pulmonary embolism as well. However, there are many factors that can also make the D dimer positive. Many factors like pregnancy, obesity, for example, aging process, liver disorders, smoking, for example. And that's why you need to report the D dimer level. However, the physician will further investigate what is going on with the patient and may use additional criteria to diagnose pulmonary embolism. So it is not just like a result and then suddenly we say, hey, this patient is having deep vein thrombosis. Of course, we have to clinically evaluate our patient to find out if our patient is really having clots in the body. But again, it has to be reported because we need to investigate what's going on with that patient. Okay, especially you have a hip fracture patient, and hip fracture patients are more prone to develop clots, right? Because of injury to the blood vessel. It's part of your Virchow's triad. Remember Virchow's triad, everyone? Your Virchow's triad: venostasis, viscosity of the blood, and injury to the vein. So these are risk factors. You know, hip fracture, you have immobility. So that can lead to possibility of clot formation, you know, bedridden, hip fracture. So letter C is the answer, everybody, your D dimer. And the normal D dimer is going to be, it depends. It depends. If the unit is DDU, D dimer units, then the normal value for that would be at least 250 and below. Okay, but if we are using a different, I think the fibrin equivalent or FEU or something unit, then that would be 500, 500 and below. So it depends on the unit. If it's an FEU, then that would be 500 and below. If it is DDU, then that would be less than 250 and below also. Okay, but again, it depends on labs. But then the one thing also that I want you to remember, guys, is this: in the NCLEX, when it comes to labs, the labs are usually obviously abnormal. Okay, because the NCLEX knows that there are differences in the normal ranges of labs. Okay, so when it comes to labs, it has to be abnormal to prevent confusion really of the students. So they really make it look so abnormal. Okay, and thank you very much for the students who has been giving us a shout out in terms of the normal value of your D dimer. Very good. Okay, so we have Ursula, we have Claire, all of you now your normal D dimer. Okay, all right, especially for international students, you have to remember that D dimer is a common lab test that we order in the hospital. Okay, all right, so the focus tonight was all about your D dimer, right? Okay, so are you ready for our next question, everyone? Okay, so number 3 is going to be select all that apply. It's your favorite, everybody. So let's see. And this is all about, we have like a lot of choices. Select all that apply. Okay, so do you know that in the next gen format of the NCLEX in 2023, there are some proposed select all that apply questions which has more than 5 options. So here you have like more than 5 options. Okay, a client with acute lymphocytic leukemia has a low neutrophil count. Which of the following interventions will be implemented? Select all that apply. A, avoid fresh or dried flowers in the room. B, place the client in a private room. C, avoid enemas and suppositories. D, take rectal temperature every shift. E, wear a mask when entering the room. F, cook vegetables thoroughly. G, serve undercooked or raw meats. And letter H, provide only unpasteurized milk. Okay, so this question will give you a little bit of time to choose the right answer. So in this question, again, your patient is a low neutrophil count. So basically in this question, we're placing the patient on neutropenic precaution. Neutropenic precaution. So make sure that you really choose the answers, okay? Be careful with your choices, everyone. Okay, think very well. Okay, which one will be implemented? Okay, all right. Okay, so you have your neutropenic precaution, everybody. Choose the question. Okay, this is neutropenic precaution. Okay, and neutropenic precaution is a favorite in the NCLEX. Do you know that, everyone? So you really need to know your interventions for this. Okay, especially the important interventions, okay, that needs to be avoided in patients with neutropenic precautions. Okay, on neutropenic precautions. So for example, you're sitting right now in the NCLEX, and then the question is all about reverse isolation. You have to put the patient on reverse isolation or protective isolation. Okay, protective isolation or reverse isolation. So which one do you think is the answer to this question? Okay, let's see, everyone. All right, let me see. So some people, okay, have different answers now. Okay, so let me see. Now when this comes out in the NCLEX, I want you to perfect this, okay, because neutropenic precaution is important. When your patient is a low neutrophil count or low WBC, neutropenic precaution also applies to patients with AIDS. You know, if their T cell count is low, less than 200, then you have to put them on neutropenic precaution as well, or let's say reverse isolation or protective isolation. Okay. All right, so let's have the answer to this question, everyone. Okay. All right, so I think we have controversial answers in the comment section, everyone. So let's see. Okay, let's see who gets the right answer in the NCLEX. Okay, let me see. The answer to this question, everyone, is going to be letters. Okay, so you have your A. Avoid fresh or dried flowers in the room. Letter B. Place the client in a private room. C. Avoid enemas and suppositories. And letter E. Wear a mask when entering the room. And letter F. Cook vegetables thoroughly. Those are the answers. So let me explain. We all know that you have to avoid fresh, including dried flowers in the room. Place the client in a private room, definitely, only by himself, okay? Avoid enemas and suppositories, okay? Why? Maybe you have forgotten that in neutropenic precaution, you also have to avoid any skin or mucous membrane injury. When you have enemas and suppositories, that can cause injury to the mucous membrane in the rectum, and then bacteria enters the bloodstream and that can cause infection. Did you get me, everyone? So avoid enemas and suppositories, okay? Avoid enemas and suppositories. Also, letter E, you have to wear a mask when entering the room. And also when the patient goes out, you know, for x-ray, goes out of the room, the patient needs to wear a mask as well. And you have to cook the vegetables thoroughly. So now let's go back over here. We have your letter D, take rectal temperature. Now rectal temperatures, you're not supposed to do that to someone who is prone to infection, okay? Because rectal temperature, you know, measurements can cause injury to the mucous membranes of the rectum, and that can cause infection. Okay, letter G is correct. You avoid undercooked or raw meats. For example, your steak. You know, steak should be avoided if it's rare. You know, so letter H, provide only unpasteurized. Now we have to avoid unpasteurized because unpasteurized milk is raw milk. Okay, so we only serve pasteurized milk, something that is processed but not unpasteurized milk. So I think some people got it right, and congratulations to those who get the right answer, A, B, C, E, F. So congratulations to who got the right answer, A, B, C, E, F. Freda Villanueva, congratulations. Okay, we also have okay, Claire, Freda, okay, Braden Sai. So congratulations. Okay, I think you're ready to pass the NCLEX, right? Okay, very good, guys. Okay, so let's have the last question for tonight. The last question is all about delegation. So let's have delegation questions, everyone. Okay. Okay. So let's see. This is your delegation question, everybody. Delegation to the UAP. So we have Asta Gimiri. She said that pasteurized milk should be provided, and that's exactly correct. Avoid unpasteurized milk. Okay. All right. So our next question, everyone. Okay, is going to be about delegation to the UAP. To the UAP. So the question is, okay, the question is, provide the client, okay, a client on chemotherapy is placed on bleeding precautions, okay, bleeding precautions due to a low platelet count. Okay, which of the following tasks may be delegated by the registered nurse or RN to the unlicensed assisted personnel or UAP? Select all that apply. Okay, so A, provide the client with a soft toothbrush or toothette. B, administer stool softeners to prevent straining. C, apply pressure to the site after injection. Letter D, report bloody stools to the RN. Okay. Letter E, use electric razor when shaving. And letter F, plan daily unit activities to avoid injury. Okay, so let's repeat the question, everyone. This is straight to the point question, so hopefully everybody will get it right. Okay. All right, so client on chemotherapy is placed on bleeding precautions due to a low platelet count. Which of the following tasks may be delegated by the registered nurse to the unlicensed assisted personnel or UAP? Select all that apply. A. Provide the client with a soft toothbrush or toothette. B. Administer stool softeners to prevent straining. C. Apply pressure to the site after injection. And D. Report bloody stools to the RN. E. Use electric razor when shaving. And F. Plan daily unit activities to avoid injury. All right, so people are putting their answers, and let's see. And thank you very much, everyone, for being here tonight. It's Thursday. You know, with the whole COVID situation, we feel isolated, so that's why I'm always looking forward to see you every Thursday. You know, it seems like we have a community or a tribe here, and I'm really very happy about that because we see each other and we empower each other, we inspire each other, you know, and we learn from each other as well every Thursday here. So that's why we try our best to go online and live on every Thursday. So the answer to this question, I think everybody has been putting their answers. Okay. The answer is going to be, all right, so let's see what's the answer to the question. So the answer is going to be, let's see who got it right. Very good. Okay. So you have letter A, provide a client with a soft toothbrush or toothette. That is within the role or task of your UAP. UAP can provide a toothbrush. That's exactly correct. Letter D, report bloody stools. Yes, of course. You know, that must be reported. A change of condition should be reported to the RN. Letter E, use electric razor when shaving. Of course, we have to avoid razor blade. You know, we have to avoid razor blade. We have to use electric razor because it prevents the blade from coming in contact with the skin and prevents skin injury. Okay. All right. So letter B, stool softeners to prevent straining. That's for the LPN. That's outside the scope of practice of the UAP. Apply pressure to the site after injection. That should be the licensed nurse or the LPN. And then planning daily unit activities, that should be the responsibility of the RN to plan the activities of your patient as part of the care plan. But of course, the UAP can provide assistance to the patient when ambulating to the activity unit or to the activity room, for example. Okay? So very good, everybody. This was a short review for tonight, and I hope that all of you had a great time. Okay, I hope that you learned something tonight for the most common questions in the NCLEX. Neutropenic precaution is not going away. So whenever you review and you encounter neutropenic precaution, memorize all the interventions. Did you get me, everyone? It's not going away. It's going to be there in your NCLEX. It's a safety issue. The same thing with your bleeding precautions as well. All right? And before we end for tonight, everybody, we have again, you know, just to kind of like introduce to you my program. So this is Matus Nursing Review Online NCLEX Academy. Of course, our flagship is going to be our workbook that everybody loves. Okay, so if you have my workbook, everyone, say if you like my workbook, put that in the comment section. Okay, and then of course my book as well. All right, so simple, fast, and easy. You can join our pre-orientation as well, and it's highly affordable also for everybody. Okay, and you can hear really all about my lectures. You know, you can hear all my lectures covering everything that you need to know about passing the licensure, and all the videos that we have in the Facebook Live. You know, all the videos are in the online NCLEX Academy as well. So all the sessions there, so you can access them, because your prioritization and delegation is a big part in your NCLEX, everybody. Okay? And before we end for tonight, so make sure that you wait because we're going to announce the winner after this. But then we have a new t-shirt for everyone. Okay. So be a part of Matus tribe. So we have this new shirt that we have. So my staff made this, and I'm so happy what she made, you know. So dare to take a risk. Okay, endure and achieve your mission. So very nice t-shirt, okay, or sweatshirt rather. So you can grab your sweatshirt. It's only $29.99, including aside from shipping. But then this is what we call the dream shirt, everyone. So I like this shirt, so I'm gonna show it to you one of these days, if we get a sample here. Okay. All right, so we have Ursula, our student right now. Okay, thank you very much, Ursula, for giving us a very positive review. I'm giving you a shout out. Okay, our winner last week is Kaylee Johnson, so congratulations. So she was enrolled into our program for 90 days. So hopefully you will enjoy our videos, Kaylee, as well as our quizzes in the online academy, and watch all the videos on prioritization delegation. And make sure that you check out the checklist, the 15-day study plan checklist, and also our NCLEX study calendar. Okay? All right, so thank you very much, everybody. Okay, I hope you got 4 out of 4 for tonight. And if you pass your NCLEX, or anyone that you know passed the NCLEX because of this program, please let us know because we would like to send our congratulations to them. So thank you very much, everyone, and have a good night.